Hello, these might feel like familiar words, but they reveal a dire situation in the NHS. Again, the wait for hospital treatment has hit an all-time high. There's also been a record number of people waiting more than 4 hours in A&E and even 12-hour waits or more for hospital beds. This is all before the winter has even hit. Let's take a look at some of the main figures from today for you. At the end of September, there were just over 7 million people waiting for hospital treatment. That's the highest figure since records began. And at the same time, there were almost 44,000 patients waiting more than 12 hours for a bed in A&E. Last October, that number was just over 7,000, so you can see how much that's risen. And as well as all of this, the NHS is desperately trying to keep up with the rising demand for cancer treatment. Our health correspondent, Catherine Jones, has been hearing one patient's difficult story.
When I was waiting for the referral to the cancer hospital, I kept ringing the breast surgeon. I've not heard anything, I've not heard anything, I've not heard anything. This needs to be chased up.
After missing 2 routine mammograms during lockdown, Caroline noticed a small breast lump late last year.
That should have been within 2 weeks, and it took 3 weeks to get the appointment for that.
At every stage of her treatment since, she says she's faced delays. The cancer has spread and is now incurable.
It's overwhelming. It's overwhelming. To be told you've only got 2 years left to live. But it's the delays that have caused that.
When GPs make an urgent cancer referral, NHS England wants 93% of patients to get an appointment within 2 weeks. But in September, 72.6% of patients were seen by then, the worst month since records began. The wait from urgent referral to treatment should be 2 months for at least 85% of patients. But in September, 60.5% were treated within the target, the second worst month. The important context to this is greater demand for cancer checks, with the number of urgent referrals rising 11% in a year. NHS England says it's that progress finding cancers early that is contributing to the treatment backlog.
We are doing everything we possibly can to get through that backlog as quickly as we can. In the meantime, as you would expect us to, we are prioritising the most urgent cases as quickly as we can.
You say you're doing everything you possibly can, but for so many patients that's not enough. What do you say to those people?
Well, inevitably, anybody in the NHS would wish to apologise to any person who's unable to get that treatment.
It's GPs who help patients deal with the anxiety of waiting, and one told us what they stress to patients is not to give up hope.
At the moment, the message from us and our practice is just kind of stick with the system. It's still very good, it's still very quick, even though it may be kind of missing this current target, but otherwise it's reassurance from our perspective.
Caroline simply feels so let down, but it's not the health service she holds responsible.
I would blame the government for not putting more things in place with the NHS. It's people's lives, and these waiting times is life or death, and now they're potentially giving me a death sentence.
Well, Catherine is outside St Thomas's Hospital for us in central London tonight. Catherine, really good to talk to you. And, of course, we know this comes off the back of that announcement we saw yesterday about nurses going on strike. Have we had any more news about that today?
Well, actually, the newly reappointed Health Secretary, Steve Barclay, he has already sat down with the General Secretary of the Royal College of Nursing, that's the trade union for nurses, Pat Cullen. Now, the government reports those talks were constructive, but it has been made clear from the outset that although the Health Secretary is prepared to talk about working conditions, like, for example, roster patterns, pay is not on the table, and it is a 15% pay rise that nurses are calling for. To look back now to cancer patients, to people who are facing treatment, facing diagnosis, the union has agreed that there will be services that will continue during a strike. I mean, A&E being perhaps an obvious example, but as to exactly which services will be protected and which will be disrupted, that's still to be agreed between employers and the union.